Good afternoon, everyone. Myself, Dr. Yamini Ramesh, and I welcome you for this special panel discussion, which is our finale session for the Cancer Webinar series. And a very warm welcome to everybody. So I'll just put up all the speakers here. Yeah, so this is a request to all the speakers to please start your video. Yes, thank you so much. Yes. Okay, so this is our fifth session, and a very warm welcome to everybody. And I'm really grateful that you all shared all the wisdom, cases, and knowledge you have with all the participants. We have received few queries from the participants in various sessions, and I have just compiled them and sent to all of you in a group. So I would just suggest that each one of us can take. Can just tell a summary sort of thing for this whole cancer webinar series and whatever you want to share with the participants, and then we can handle the questions separately. So can we start with Dr. Shruti, ma'am? Ma'am, very good afternoon.
Very good afternoon, Dr. Yamini and the panel doctors and participants. I greet all of you. So it has been really a learning event, and I congratulate for organizing such a wonderful event. Shall I come directly to answer of any query, or what do you expect me to share?
Ma'am, whatever you want to share, and also the queries. I also want to ask you that what are the from all the speakers, I just want to ask them that what are the 5 key points or the main key points which one should remember or do in dealing with cancer cases, which are the most important things according to you. I guess that will help each participant to keep in the mind so that they can deal with the cancer cases in a better way. So if you can share that.
I had already told in my seminar, but I would like to repeat that Dr. Hanuman has said one remedy at a time, not one remedy all the time. Right? This is, I mean, you need to evaluate each time because in cancer, the presentation will change so rapidly. So you really need to be open-minded and see when you take a follow-up that what things are coming, what changes you are seeing, changes at mental level, physical level, in the symptom-wise, the side has changed. So you need to be very vigilant and be prepared if not to get stuck to the previously acted remedy. This is one thing.
Okay, thank you so much for sharing this. And this is a big question also. A lot of participants have asked that, when to change and whether to change or not, because this is a constant confusion. So like you said, that whenever there is change of presentation or change of indications, we have to think about changing the remedy, because because it's very quick in cancer cases. Same thing I said in my presentation also, that we have to do the follow-ups quite quickly in such cases, because the
And you have
pathology
to
is,
really remain open. Now,
yeah,
when your medicine is acting, keep on holding it.
yes,
And yeah, I have seen a lot of queries regarding the posology.
yeah, many.
So I would share. Shall I share, or
Yes,
just
ma'am,
want to
please,
continue
please
with
go
this?
ahead.
So I would share my experience. Like when I started with the canteen method of giving one dose and wait and watch. But I have seen that when you prescribe a right constitutional remedy, patient really improve uh, within a short span of time, but symptoms return very frequently, or the indicated medicine has does not act very fast, or it does not hold the symptom. Then I started using LM potency, and from Sarkar sir and our own insight and study of organon, we have started using this plusing method, ascending potency. So I generally rarely now use dry doses, but this water potencies and using LM potency, I think it is far more superior in action. It is faster, it is quicker. You can daily repeat them, and it lessens the time. And so, in my practice, I have seen wonderful results with water potency. So I am a huge advocate of water potency. Even 30 I have to give, I will give, dilute it in 100 ml water. I will tell patient to 10 succussion, give 10 succussions or 5 succussions, most of the time 10 succussion, and then take 5 ml. It can be given 3 times, 4 times, 1 times, twice, as per need of the, but I have seen that they work wonder. And I give it daily till the medicine is holding. I give water potency. I keep the patient on water potency. I have seen if we stop, recovery stops. So whatever it could be 200 years back, because we are now staying in an environment where we are daily exposed to chemicals, then this e-smoke, this radioactivity, then we all have Wi-Fi at our home. We use lots of uh, uh, this cell phone and all screen exposure. So I don't trust giving one medicine and wait. I keep on giving till the my medicine is holding. I give medicine in water potency daily. This is my experience, and I have never seen any aggravation. Rarely it happens. So you tell them, don't take next day. Then it goes away. Because basically, when you prepare 100 ml dilution, either you add 3 drops or 3 to 5 pills of, it's a single divided dose. And LM potency also, it works wonderful.
Great, great. Thank you. So, ma'am, the centesimal potencies and LM potencies both you use in water.
Water potency, yes.
Okay. Thank you so much. Ma'am, one more question which we received during your session only, that what to give after chemotherapy or after radiotherapy to combat the like common side effects?
Yeah, I mean, see, after chemotherapy, there will be generally nausea, vomiting, weakness. So if Nux vomica, Ipecac, China, because there is a lots of the good cells are also burnt. Then yeah, this arsenic album, this kind of medicines will be very effective. You have to see weakness after acute disease, this kind of rubrics. If there is a radiation burn, I give calendula, cantharis, radium brome, X-ray, causticum, all the burn medicines, right? Because we are burning. So if it is post-radiation, I give medicines which are listed in repertory under injuries, burning, right?
Oh, great.
And if it is like a loss of vital fluid, this kind of rubrics can be used. And these medicines do come often, and they help at large extent. Like Nux vomica, we give for side effects of allopathy drugging. So when patient is taking so much medicines, then we can think of Nux vomica. Alosocotrine also comes under this category, right? And backflower remedy I use a lot.
So, ma'am, one more question arises. Can we use batch flower remedies along with the homeopathic remedies?
I use as company, because there are many things ongoing, right? There are genuine symptoms of patient, like their constitutional type. And one way patient is experiencing because he is going through a very traumatic discovery. He has suddenly been diagnosed, and you do not have enough time to act. So I give like combinations like rescue remedy or ornithogalum ambulata or lark to fear, combat the fear, such kind of medicines along with the constitution. It could be my own state that we do not have enough time. Or it
No,
could be
that's a true state. Okay. Okay. Thank you so much, ma'am, for sharing this, because this is very important, and these are some very vital points that how to use and can.
I use mother tinctures also along with the water potency. Then I use biochemic salts also, because there are lots of patient has wasted. There is lots of cachexia. There could be lots of nutritional deficiency. So I use, and see, patient needs to have good stock of medicine. आप एक डिब्बी देके भेज जाओगे, नहीं उसको psychologically benefit होगा और नहीं हमें financial benefit होगा.
Very true.
I prescribe medicines. Patient also feels happy that he has given me one biochemic salt, one biflower remedy, one water potency, and some supporting mother tinctures or just placebo. This is how I work.
Oh, great, great. Thank you so much, ma'am, for sharing.
Dr. Yamini, before you, this is Jyoti.
Yes.
I want to ask Dr. Shruti one question,
Please,
which
please,
I face most of the time. Can I, Dr. Shrutisha?
Yeah.
Yeah. I am a big, I am a big fan of you. I am learning a lot through, following you. And my question is during metastasis, usually how I practice is I see sphere of action and like that. But during 2-3 metastasis where 2-3 organs are affected, I find sometime difficult to choose. Chelidonium like medicines cover a lot of organs, lot of other organs also. But can you put some light on that, where how you should we should work when there is a metastasis with
See, I understood. Dr. Hardik is better person. We have devised a strategy. Dr. Hardik, you are a better person to answer this, but I'm giving few hints than Dr. Hardik. See, when
you carry on, I will intervene later.
Yeah. So when a patient comes with metastasis, like she has lung cancer, breast cancer. Now it has gone to bones and it has gone to lungs, for example, and you will have paucity of symptoms, right? So what to do? I open the repertory. I enter the symptom breast cancer. I enter the symptom lung cancer. I enter the symptom bone cancer. So I will have a medicine, cancer medicine, which has a range that it is covering breast, it is covering lungs, and it is covering bones. So the range of remedies will be narrowed down, right? So this is the way I have learned, and it helps.
Okay.
Dr. Hardik, your turn.
So thanks, Shruti. So this question is like mother of all questions, I would say. But then one approach, because I will say something else which I wanted to convey today. But since the thing of multiremedia is coming up, so there are phases which always comes to us. I always learn from Dr. Sarkar that every follow-up is like a new case as far as cancer is concerned. And it's like a googly every time. And every time you need to be equipped with some other weapon in your hand. Now, when the question of metastasis comes, and also question of the remedy, which to be given, when to change the remedy. So let us address one issue of what Shruti lightly pointed out is a backflower remedy. Now, one remedy she highlighted was, like ornithogalum. It's such a wonderful remedy which actually prepares the patient, first of all, to accept that I'm having tumor. This is one of the very practical remedy. I think, Shruti, we are using it very frequently with reasonable amount of success. So that is one phase. Another important thing I would just extend what Shruti told is like, take the organs like bone cancer or lung cancer or something. Like at this kind of complex cases, Henneman's, I would say Senapati was like Boningason. He appointed him as to develop his repertory and all. Still, Boningason and Bogar are so relevant. Just take the organ which is affected. Just take the organ, repertorize that. Boningason approach is like still working like anything. At least it will bring you to that that position where we are able to make some prescription. Whatever organ is affected, for example, lung is affected, stomach is affected, head is affected. At least we can just take these three organs and take something like what Dr. Shruti told, that take cancer as a. So it will put you in one position where your remedies will be closer down. So this approach is like one of the tried and tested approach as far as any disease is concerned. Why not for cancer? So this is I want to add, Shruti, as far as this talk is concerned. And another thing is like use of organ remedies or use of backflower remedies or biochemic. Yes, they are very well needed. I would always say cancer treatment is not the regular treatment where what you tell like any asthma or rheumatoid arthritis. This is a very, very different thing. And patient comes to us in a very, very diverse form. Like for example, take random 10 cases of breast cancer. I'm using the breast cancer thing because mostly we have cases of breast cancer, but then all 10 patients are very different, and they show up. The timing also when they come to us is very different. Whether they're coming to you as a stage 1, stage 2, stage 3, stage 4, they are coming like completely like without any chemo or radio or surgery, or they are coming to us with chemotherapy, radiotherapy. So various phases, when the patient comes to us, also decides the treatment of that patient. And then comes the question of posology. I would still say that I am very, very, but you know can we say that I'm very, very little I understand about posology so far. Whatever we are doing, we are doing, but we are at a very, very, very neo stage as far as posology is concerned, as far as cancer. But then these things should be kept in mind, what stage patient is coming to you, and always the stage, the layer should be treated first. What is upcoming layer? You feel that this patient is of this constitutional remedy, you give it, it don't work only because patient is already loaded with some kind of radio or chemotherapy which is already not allowing the natural constitutional state to come up. At that time, use of organ remedies or Dr. Varno will suggest or drainage remedy, they are of a wonderful help. And as ma'am pointed out, like role of chelidonium, it works wonderfully. Let me also come to certain remedies which are used successfully. Obviously, whenever a chemotherapy is going on, patient will tremendously respond to remedies. Two remedies which Shruti pointed out, they are like weapons, Naxomica, Ipica. They definitely work. But then 2-3 more remedies which I have to point out. One of them is Symphony Carpus. Very interesting remedy. Another is Cocculus. Now, these two remedies I would consider they are like underdog remedies. Like one example I would give, like a chemotherapy drug like cisplatin. Now, cisplatin typically produces a lot of vomiting as a side effect. It also dehydrates, and it also produces a lot of dizziness because it is ototoxic. Now, this is classically seen in cisplatin. Now, remedy like tabecum and remedy like Cocculus bypass is Noxomica and Ignatia. So this is some practical experience which on hand which I have, and I'm just sharing that which chemotherapy drug producing which kind of toxicity. You repertorize that organs. If you ask me cisplatin, yes, it is a gastric and an ototoxic drug, and it produces lot of dehydration. So combine three, I come up with Cocculus and tabecum. So sometimes this is also a technique which we have been using with reasonable success. As of now, this much. Yeah.
Yeah, thank you, sir. Sir, I like you said that if 10 patients come off the same thing, like breast cancer, for example, and they will come to you at different stages. So there was also one question from the participants that at what stage, or how do you decide that you should advise the patient for the surgery or not? Like how to understand the scope and the limitation if you're already treating a patient. Suppose stage 1 is there, we can surely say that okay, we can wait a little bit. But if it comes little later, if the patient comes little later, then how to decide and what to advise?
Uh, One thing, like, there are three options available as far as a mainstream treatment available. That is, I would put myself as, put myself is ourselves. Let us consider ourselves as a complementary medicine as far as cancer
Yeah.
is concerned. Okay.
Yes.
Now we have a lot of scopes and everything, but let us put ourselves at one side. We are a complementary medicine providers. And let us go to the mainstream oncology treatment, which provide three treatment mainly. One is surgery, one is chemo,
So,
and one is radio. Now, practically someone may differ or not, but then if we ask you which is the safest, I would say surgery remains to be the safest if it is very very initial stage,
okay.
because most of the cases can be prevented at a certain level, not all cancers. Okay,
Yeah.
surgery is a safer option as far as if chemo radio are concerned. Very practical aspects I'm talking. Now chemo has its own thing, which chemo has been given. That is also, like I told you one case, like, those patients who are responsive to chemo, they are also responsive to homeopathy.
Yeah.
And it is another side also. Those patients who are not responsive to chemo, they also do not respond well to homeopathy. So this
Okay.
is a very practical thing which I see in homeopathy. Now comes to question what to advise and what to not to advise. So ethically, you cannot tell any patient that you don't take chemo, don't take radio, or don't go for surgery. Practically and ethically both ways, because it is always a patient's choice, and we cannot be like so much like forcing the patient mat lo chemo. There are reasons for it, certain reasons for it. First of all, we do not know what is going to be the next stage in cancer, so let the patient decide. Most of the time when you give a choice to the patient that you decide what you want to do, these are the options available.
Yes.
And that option should be decided on. Take the tumor, which tumor patient is coming to us. Mostly patient will come to you with a biopsy done, and mostly
Yes.
patient will come to you with a MRI done, or mostly also PET scan done. So PET scan will mostly tell you about the prognosis.
Mm-hmm.
Best thing, go to the book which we refer very usually is the Harrison's Oncology.
Yes.
And very very practical, we go to what is the guideline given, what is the therapy given. Go read which chemotherapy is advised in this, which radiotherapy advice, and after radiation therapy or surgery or chemotherapy, go and see what is the mean survival rate in this patient.
Mm-hmm.
It can be anything between 2 years to 5 years in most of the cancers, and it can be something like notorious cancer like GB cancers or liver cancer, it can be less than 3 years, less than 2 years. So if
True.
you are able to break that barrier of that year's mean survival, your advice should be according to that. And when the chemo or radio says that the mean survival rate after giving chemo or even not after giving chemo is going to be same, these patients are going to be the safest, where you can clearly say no for chemo, and then let patient decide. And then let patient decide. The cases which have a mean survival higher till 5 years with chemo or with radio, give patient a choice. Okay, we can also do now when the survival rate of chemo is higher, means our medicines are also going to work better. This is the algorithm, very practical algorithm which I follow. So this should be the advice. The problem of us is we do not want to refer oncology textbooks, and we do not refer. We refer clinically. We refer what is this tumor, what is the thing. When the investigation part come and the treatment part come, we largely use a blanket term allopathy and chemotherapy, and then we don't even read. So this is big fault from our side, and the whole game of treating cancers by mainstream is which chemotherapy or which adjuvant therapy, which protocol to be taken. And if you read the literature, there were very clear cut guidelines. At this stage, this much dose and this much protocol has to be given. If the stage is crossing this much, if this much number of lymph node, this much has to be given. Honestly, ask yourself, do we have this much research? We do not have. We do not have any data. Now that data is real, manipulated, that is a second thing, but we do not have this data. But then whenever that data is there, use that and use it in a smarter way. How we can use that, where we can intervene. Read the side effect of the drug. So even if patient is taking, you are ready with what to give next. So this should be borne in mind. when you're advising a patient, and you have to be very, very tricky with your mouth. Your enthusiasm is at one side and the reality of the patient is on another side. And I would say go with the reality of the patient and not with your enthusiasm.
Yes, very true. Thank you. That's a great advice, actually. And you rightly said that we do not read the oncology books because that is a must. We do not actually, most of the times I also feel that we don't understand the pathology well. So, and that is that becomes a limitation. Then we, cannot advise anything because what to do and what not.
But I differ little here. Sorry.
Yeah.
But if we stick on like this, no, unless Dr. Shruti wrote breast cancer book, we didn't know how it works, how pathophysiology, how medicines, even weed medicines was a new revelation for people like me. So I think somewhere we, along with the allopathic knowledge, I think we have already so much in homeopathy which we have not explored. I think parallelly we should also work where we can understand what all other medicines can be helped useful in homeopathy. When you read Yakir book, you can come across some remedies where clearly she explains why it is important for cancer cases. So I think just I am adding with all the knowledge of allopathy, I think Materia Medica knowledge should also help us. We should work towards that. We know our limitations, but we can explore possibilities of, helping patient here.
I have something to add. May I, Dr. Yamini?
Please, ma'am.
Yeah. So Dr. Hardik has taught all the diplomacy needed, which I have learned with time, right? While dealing the patient, so I won't go into it. But there is one thing which I clearly say to my patients. They don't listen most of the time, but I have strong conviction that when there is a family history of cancer, if you go for surgery, cancer will reappear faster because it is in your gene, right? A genetic therapy can be of help, but if it is a strong family history, you go and cut it, you go and burn it, you go and chemically burn it, it will recur, it will reappear at the faster pace and at the dangerous place. So this is my clear advice to patients. If they want to go, they must take homeopathy after it because there are only two things in this world right now which can cure cancer, miracles and homeopathy. Right? We are underdeveloped, we are yet developing, it is a different thing. We do not have data, it is our lacuna. So system needs to do that, government needs to build up a strategy, but yes, we have a tremendous potential. And other thing which no oncologist ever talks about, you go and find, you Google one thing which is called Phoenix Rising Pathway. Have anyone heard about it? Phoenix Rising Pathway?
No.
Ma'am, can you repeat it?
It is Phoenix Rising Pathway.
What is it?
It explains that why cancer reoccurs even after you surgically remove it. It is that cancer cells work like stem cells. They are stem cells, right? So when there is an injury to any stem cell due to apoptosis, there will be excessive release of this pathways which leads to injury and repair. So there will be so much again, like so these pathways which were intrauterine will be again reactivated. As these injury pathways are reactivated, there will be lots of prostaglandin secretion and other interleukin 8 and interleukin 6 and interleukin 12. These pathways will be again reactivated. And what they do help to proliferation of stem cells. So what will they do here after surgical removal of cancer? That they will help to proliferate the malignant cells in a faster pace. So because of the surgery, otherwise the malignancy which would have really progressed at slow as you have removed it surgically, it will really develop at the faster pace than naturally what it would have. So actually surgery, chemotherapy and radiation has, according to me, no role special in genetic disease. Rather they make the person, they worsen the patient and they push them towards the death earlier. Right? So this is the truth which has remained hidden from, I mean, no doctors talk about it, right? That if you go for surgery, this phoenix rising pathway will be activated, and there are the chances you will have faster chances of spread and recurrence and metastasis of cancer. So,
and what about yeah, continue.
I need to deal with this fact diplomatically so that I will not be ethically or legally questioned, but the truth remains the truth. So I would suggest the patient, if they come to me, if they ask for my opinion, if I feel safe to express my opinion, I tell them, when you start homeopathy, because we do not have 100% research, you believe that homeopathy is not going to act. Still, for the benefit of this patient, when there is a strong family history, let the cancer remain there. Don't manipulate it. This is my opinion. I may not express it. I may deal with it diplomatically. I may not say about it to any patients, but we are here, we are. So I'm sharing it.
Because and what about all the diagnostic things which are increasing the cancer stages?
Yeah, they are doing. But I mean, biopsy is a little insult, right? A surgery is a bigger insult. और ये 6-6 घंटे जो सर्जरी चलती है, मतलब वो पेशेंट आएगा कि हाँ पेट स्किन ठीक हो गया, फिर 2 महीने में पेशेंट गुजर गया. And so we see this daily.
So Shruti, I would like to intervene at this point. So I am just addressing some practical points which we face day in and day out. And since we are a mixed bunch of from very junior doctors to middle level to very senior doctors, some experience, some inexperience with homeopathy. But let us acknowledge one fact that, see, we are at a very evolutionary phase. Practicality, clinical experience is something very different thing what you are talking about, or me or the Dr. Jyoti is also talking about. And let us talk it not in a diplomatic way, but let us talk in very, very, very practical way which is needed. So if 3 things are, I'm just putting in that way, people are asking surgery karani nahi chahiye, chemo lena chahiye nahi chahiye, radiotherapy lena chahiye nahi chahiye. We all know the dark side of it. We all know the dark side of. No one can prevent what is coming. But the thing is, when you are sitting in a chair and when patient is coming to you, at that time, what to answer is a very tricky thing. And believe me or not, it's a very tricky thing. At a higher level of experience, you can be like, okay, this and this not. What is to be done and what is to be not done. But the larger chunk of homeopaths are not at the 10% bracket, who are very much experienced in treating cancer. And it's a very evolutionary phase. So my advice would be, go ladder by ladder, step by step, see what is working, try out something. First, try to treat very, very simple things, whenever you are handling a case of cancer. If you're able to overcome a little side effect, go further. Even if you're able to, so that should be a step ladder process. Gradually, you should process. And then comes to question of, some very interesting remedies. What Shruti is proposing in her book. They are at a very, very different kind of thinking, because is to understand that where cancer goes and where cancer doesn't go. And we can see above the routine things. But then first thing would be try to treat routine things with very routine remedies. And Grimmer, Bernoulli, the homeopaths which are like, we don't even know about, like no one knows about Grimmer's work. He has treated thousands of cases of cancer. His literature is completely underused. So I agree with Dr. Jyoti ma'am. A lot of things need to be done to read and discover materia medica. And then we can achieve what, what Dr. Shruti is conveying currently. So aphorism number 3 should be our mantra. Knowledge is knowledge is knowledge is knowledge is, and the application of it.
Yeah, so for practical purpose, what I do, if patient has very good vitality, is robust, they are willing for surgery, right? I let them go for surgery because they can handle the trauma. The system is strong, and then we treat. Even the patient will not like to take risk with unknown system, unproven system of medicine, then following the conventional. So I let them go for surgery. So they are safe, and we have ample of time to work later. And we are not taking risk, or we are not doing anything unethical or illegal. But if a 65 plus patient comes with a strong family history or metastasis, I tell them don't go for surgery at this moment, because honestly, the patient is debilitated and may not be able to handle toxic effects of chemotherapy and surgery. So I tell them this way, then it is up and them. Because being their well-wisher, you have to tell them the facts gently. You have to really learn the art of communication and diplomacy both, which I may not sound at this moment, but yeah, we use lots of diplomacy and gentle way of conveying the facts, which Dr. Hardik is very good at.
Not so much related. Dr. Afiza wanted to share some.
Yes. Yes, Shruti ma'am, am I audible, sir?
Yeah.
Yes. So, I would like to share that whatever I have learned on oncology, I have learned from sir. And as Shruti ma'am told that he is very good at diplomacy. So, all that also I have learned from him. But recently, today morning only, I had to answer such questions. So I'm very fresh at answering. Today morning only I face such questions. So when the person or the relative, the recently I diagnosed the prostate cancer case. The patient just came with a BPH since 2 months, and I did a PSA report, and PSA came 1110. So the pathologist called, it is too high, madam. So look into the case. So the patient's son was a physiotherapist. So I called him. So what happens when we break the diagnosis to the family starts panicking. Although I told the son that don't tell your father about the diagnosis, otherwise it may worsen the case. So we'll decide the line of treatment. But again, the question is, should we go to oncosurgeon? Should we go to a uro specialist? Should we do MRI? Or should we go for biopsy? If we'll go for biopsy, will the prognosis will get worsened? So all these questions we have to face in day-to-day life. And what I think is that one reference we should let the patient decide. One reference we should give time to the patient to decide, and go to an oncologist, also to a urosurgeon, whatever they suggest. And yesterday even we talked with a urosurgeon about the 2 cases of CA bladder and prostate cancer. So they have very, as sir said, and as Shruti madam is telling, that they have very fixed protocols. So they are directly asking you how many centimeters the invasion is, which angle the invasion is. So we also have to be such precise in our diagnosis and in our line of treatment, that how much the transitional cell carcinoma is there, then how much, which area or which layer, muscularis layer, the cell is invading. Or even in BPH or prostate cancer, if it is moving or it is pushing the rectum or other there's other glands, so that we have to be very precise. And one case I also shared with sir, the diagnosis of prostate cancer was in 2017, and he was a patient in LA. Also, he's a far relative. So he was taking treatment, but he had not taken any allopathic treatment. Their homeopathic medicines are not available. So he took some herbal medicines, and then he came to India and he started with us homeopathic medicine. And one thing he was very clear, that all his family member died of cancer, even his and his wife. family member. He is prostate cancer patient, and his wife is having CA bladder, and both have family history. So they were very clear that we don't want to go for surgery. Any alternative medicine will be okay. So today it is 2023, and even his PSA level are rising. In 2020, his PSA was 30, and today his PSA is 50. But there are no sign and symptom. He is hale and hearty. Even the sexual libido is good. And the main thing, as madam said, constitutional remedy we should know. And plus with that, mother tinctures. Lobelia arenea was the mother tincture that he is continuously on Lobelia arenea mother tincture, and hydrostis mother tincture, and other all symptomatic remedies, subulcerulate and everything. But these two mother tinctures with intermittent dose of carcinosin, he is alive, hale and hearty. And they have cancer group in US. They have very close cancer groups patients. So whoever went for this surgery or chemo radio, they all expired, and he is like 75 plus. So he is still hale and hearty. And recent visit, he also came recently also for my sister's wedding. So he was like, we are able to live hale and heartily with homeopathy. So like 5 years is the prognosis.
So congratulations for that case.
Yes, sir. Thank you. Thank you. So sometimes we have to be, little bit. Yes, sir.
You tell about, sorry, I just lost the network. Yeah, so when you're talking about urothelial carcinoma, I'm just taking this example because you spoke about transitional cell carcinoma. So when TCC is there diagnosed, we should be aware where TCC can go. It can go to bones, immediate, it can go to lungs, and it can go to liver. No other place TCC go usually. So if you're able to foresee this and you are able to follow up your patient looking at these parameters, we are doing our job. So down the line at 2 or 3 years, the patient shouldn't have reached to this level, or it has been slowed down. Then practically we are doing our job. So this is just a practical thing which I want to highlight in any case. Like pick up any cancer, say breast cancer, look at where all meds can go. And connecting it with what Dr. Shruti told initially. Take that organs. And then Boger's approach. And then which organ remedy can be added. Which emotional state patient is passing through, which backflower can be added. And where carcinosin as a nosode can be used. So in one case, see the multiple facets where we can look the same case from different angle. We can apply it all at time as and when required. Shruti, you want to add something on this? Now I will ask Shruti, because since she has discussed a very nice case, Hafiza. Shruti, can you tell that one case, I forgot Tabacum case?
Yeah.
I do not know whether you shared this case during the series or.
I have not shared it.
So if you can tell, how that symptom was helpful in treating the cancer, it will be very because that approach is the best approach which one should take. That is, I'm asking her for that case.
Yeah, it was a rectal cancer patient. Patient was of 82 or 83 years when they came to us first time. It was when Dr. Sarkar was visiting our clinic to see cancer patient. We used to have cancer camp every 3 months. So then this patient came, and it was my beginning of cancer practice. So patient was addicted to tobacco, and he was advised for a surgery, which patient was not ready, because rectal cancer surgery, he has to carry the pouch of stool every day through lifelong. So patient was not ready. And what patient's relative emphasis that patient has come once but will never again come to show you, because he has got severe motion sickness. It is so much weakness and so much sickness that he cannot even sit in a rickshaw. So to travel 100 kilometers from where he's staying in a village to come to my clinic is so much bothersome. And Sarkar sir smiled and gave Tebecum on this symptom. And the patient with Tebecum, within 2 to 3 months, I had followed. Patient was doing fine. He had no pain, no bleeding, everything recovered, and patient was doing good. But he never visited me. So I again repeated Tebecum. Then I got the news that his son used to come. My father is still not comfortable coming to you. So I kept on giving the Tebecum in LM potency. And you believe I gave him Tebecum for 7 years in LM potency because he still is having this more motion sickness and he was improving. So I gave him a Tebecum. Recently, the son came and he told me there is no cancer now. So, and the patient is 92-year-old now, right? So,
how many years of follow?
9 years of follow.
Repeat it.
Amazing.
Repeat it.
9 years.
Repeat it.
9 years.
So that's the magic. That's the magic. This I want to like.
Okay, rectal carcinoma in
notorious.
Very notorious.
Notorious tumor.
Still drives the bike, goes to farms, looks after the farming, and but yet has not come to see me after for 9 years because he's still having motion sickness. So I give him Tebecum, nothing else. In LM potency, he's taking it. But as long as, who cares about the side effect, possible side effects of homeopathy when the cancer, rectal carcinoma gets cured and patient is living a very normal life at the age of 92 years. So this is LM potency, this is homeopathy. And yeah.
And the symptom which you use.
Symptom which was picked up by Dr. Sarkar.
Yes, so whether common cold or
that if patient is still having motion sickness means he is still in the Tebecum stage. And as long as Tebecum is working, I don't want to change the prescription. So frequent repetition, frequent change of remedy may not require. If you have this vision and confidence.
That's the ideal case of, one can have of treating cancer. This is ideal cure what we can tell. So common cold or cancer, symptom matters. If you're able to pick that individual symptom, that's the entry point. And you do not know where you can go.
But do you have difficulty in convincing patient to go for diagnostic? This sometimes patient is better, but our, cancer or any other pathology may worsen. So do you have such experience where they refuse to go for X-rays or CT scans?
Yeah, they refuse, but I insist. And when they come to us for the treatment, मैं उनको कहती हूँ आप जाके बायोप्सी करवाओ, पेट स्कैन करवाओ, oncologist के पास जाके आओ, क्योंकि वो वहां पे जाएंगे, पूरा घूमेंगे, वो सिस्टम को देखेंगे, फिर हमारी कदर. Right, and I insist कि have regular follow-up. मतलब आप oncologist के पास जाओ, regular checkup करवाओ.
Very true.
There is another side also. The doctor treating the patient is improving. The doctor is scared कि इसको भेजेंगे और कुछ नहीं ठीक रहा तो क्या करेंगे? It's better continue with whatever treatment which is going on. This is on a lighter note I'm telling.
No, it has happened many times because they don't want diagnostic things. They come to homeopathy. See, that is one more wrong notion we have in our public. Allopathy doctor बहुत सारे test कराते हैं. Homeopathy they don't ask many. So here also in the beginning we have failed. That we thought patient is doing well. So we'll wait. But that's
no. Sorry, I'm interrupting you. I take a symptom, mild fear of injury. Right? When they come to homeopathy, 50% time that there are 32 remedies in a rubric, mild fear of injury, mild fear of accidents, right? Because it is their state. So we need to, maybe we may not push, but we need to treat that state or give some thuja or belladonna, either fear of injury or they are postponing or there is a strong psychotic state that they don't want to be discovered. So sometimes it gives us a strong clue. Okay. This is the state which we need to address.
But then serial checks we can do with like we may not go for PET scans so frequently. We may not go for MRIs because ultimately cost factor also matters. We also need to understand which socioeconomic position patient is. But the tumor markers are not that so costly, and they can be of a tremendous help whether a remedy is working, you are in a right way or not. So tumor markers should always be handy with us.
Yes.
Like
Sir,
prostate
one more
में,
question, small question. Any cases you have come across where patient has already taken BCG treatment after this CA bladder, and what is the side effects or what is our prognosis after BCG treatment?
I have not encountered any patient after BCG treatment.
Okay.
Like bladder cancer itself is not so frequent cancer which comes to us. But in so far,
Okay.
I have not got any patient. I have 3 or 4 bladder cancer cases, but none of have taken this treatment. So I think if Shruti has
Yes.
an experience in that, she can.
I
Yes.
wanted
Dr.
to
Jyoti.
show this one book which I have purchased and never read, but plan to read. Can you read it? I mean, can you?
Cancer
Yeah.
biomarkers. Yeah.
Markers.
Yeah. It's minimal and non-invasive early diagnosis and prognosis. So I wish to master this. I have not read it yet. But these are the things that you can be sure of your prognosis with the help of biomarkers. It is big book, means there are lots of things has been done but not been utilized fully. So I wish to.
So
A lot
I
of
would
prostate cases and ovarian cases, as Dr. Hardik was telling, comes because of this only.
Yeah.
Because by default nowadays in master checkup they are doing some tests, So ovarian and I think prostate cancers we are getting only because of this.
Yeah. PSA is a very common test which they perform, and also the CA 125 thing.
CA 125, yes.
Regular one.
So, Shruti, why don't you type the name of that book with the author in the chat box? It will be helpful to everyone.
Sure.
And another thing, when we are using this blanket term allopathy as homeopathy, let us start using something like, that cancer biomarkers or pathophysiology of cancer, because they are not restricted to allopathy. They are published by, of course, that science, but let us make use of that terminology in a very, very, clinical way. Like biomarkers like this book or Harrison's Oncology, these 2 books, I think, everyone must read apart from homeopathy. You will understand that homeopathy books in a very, very different way. You will understand, how much work we have done actually before. We have a lot of literature, with Dr. Jyoti also pointed out कि हमको हमारा ही literature कितना है ये नहीं पता है.
Sir, I want to ask something at this point to all of you. That kindly tell us some books or literature which one can go through. Whatever, like your favorites, or you think that.
Let us go one by one. Let us start with Dr. Jyoti. One book and then we'll.
Yes, Dr. Jyoti, ma'am, please. Favorite literature.
Actually, I go by Metria Medica. I don't have, and whenever breast cancer cases comes, so first I'll read again. I don't know how many times I have read Dr. Shruti's book. That is why I was asking her when is your next book is coming, and I keep in touch with Dr. Sarkar sir's all the literature and all the videos where he'll teach us, where he was asking us not to send too many times for CT scan and other things. Other than that, I don't have a specific book. I repertorize such cases nowadays, which I was not doing for other cases. Otherwise, I don't have any favorite books on this.
Okay, thank you. So just you think you said Dr. Shruti's book on breast cancer,
and both sir's books, 2-volume books are there, no? Just you think and yeah.
Just you see and just you think.
Yeah.
Both of them.
My favorite book.
Yeah.
My BHM studies boric materia medica.
Yes.
Not able to read it.
Very true. Boric.
Very, very true.
Yes.
मुझे भगवान पूछेगा ना कि तुझे क्या मतलब सीखना है, तो मैं कहूंगी कि बस बोरिक आ जाए.
645 remedy.
नहीं नहीं, वो जो मूवी में दिखाते ना, एक बार ऐसा करो बुक सब अंदर चले जाए.
तो नाम भी नहीं आते पूरे दवाइयों के.
Correct.
So yeah, my all-time favorite.
Oh.
From first year of BHMS till now.
Very true.
Thank you. Ma'am, any specific like literature which you refer for cancer cases?
Grimmer, Dr. Grimmer and Dr. Sarkar.
Grimmer and Sarkar.
I have read all the books available on cancer, but these two, I mean, Dr. Sarkar's one I can really correlate, and Dr. Grimmer has done is a hidden treasure. So these two books I really, Barnoville and Grimmer, they have together they have also. So these two are my favorite.
Thank you. Thank you. Sir, your turn.
Yeah, so Grimmer, Barnoville are like Boric are always favorite. Without that, we cannot do anything. But Harrison's Oncology, practically easy, available book, very simply mentioned protocols and everything. One must read. And another there's an author called Bagot, a French author.
God.
Yeah, he's an oncologist.
Can you repeat, Dr. Hardik? Sorry, I missed it.
Dr. Bagot, Bagot.
Dr. Lionel Bagot.
He's an oncologist, and he used to practice homeopathy. And so he has nearly 20-25 years of very rich experience. And that book is not available in India, but you may find outside somewhere. But it can be imported. So this book is one of the very practically book. And Barnoville, I would like to make a mention. And another one is Rademacher's Solutions.
Rademacher's.
Yes. Rademacher's Solution is like a very, very nice thing to go. Shruti, which one? Clark, yeah. One interesting thing from Boric, Hafiza pointed out a remedy called Lobelia arinus. And in Boric's Lobelia inflata, there is 2 lines mentioned regarding Lobelia arinus. And if you are able to just read that the pace of the disease, it is very fast remedy. So a fast developing cancer, think of Lobelia arinus. These small wisdoms are like भर के दिए बोरिक के अंदर. Now how much point we are making, meaning we are making from it, I would say you require no other book than Boric.
Very true. Yes,
you are able to make a meaning out of it, correct meaning out of it.
Yes.
There is another book, small book. It's Oxford's Cancer Handbook. It's a small book, very small book. I think if you want to do nothing, Oxford ka handbook aata hai cancer.
Oxford's Cancer
Handbook. Yes.
Handbook. Okay.
Yeah, it's like a very small book. You can just keep it in your bag. In 2-3 pages, it describes the cancer. Like clinically, if you want to understand cancer very faster, it helps a lot.
Okay.
So every cancer only 2 page, 3 page, nothing else. So it's like a ready reckoner.
And how to manage pain in cancer cases?
It's something we really need to master. Yeah, I was about to give, if you want to learn, start your cancer practice, forget the everything else, learn the pain management, and half battle is won. So you need to, I'm just learning it, so I do not have much to say. Chamomilla helps a lot. As Hardik has said, euphorbia family never helps, right? But yeah, you need to master this. And once you relieve the pain, patient's faith is really yours forever. So creosote, hydrastis, then for pancreatic cancer, Hardik, which medicine? Calcarea ars, I think, right?
Calcarea ars and atropine phos and atropine sulf.
Spigelia for rectal cancer.
Yes, rectal cancer. Alumen also for rectal cancer.
Alumen also helps in managing the pain of. So you need to master the neuralgic remedies actually.
One another remedy. No, I have never used it. Incidentally, I had at my clinic. Yesterday only I was reading about the remedy that is epimorphium. It's a morphine derivative, freely available. St. George का मेरे पास भी पड़ा है, but so nicely mentioned about it, by Boric, 1.2 line. Euphorbiaceae family, all remedies, they are very helpful.
There is also a rubric in pain, cancerous affections painful. There are 82 remedies. So I wish to study these 82 remedies. I mean, one of my book would be on, if I live that long and not this much lazy, would be on.
No. Before I go, you please publish this book. I want to read. मैं आपसे थोड़ा बड़ी हूँ, जल्दी लिखो. I'm waiting. कोई भी आपको help चाहिए बताओ. मैं और
we can have a poll of everybody and everybody will say yes, please write a book on this.
No, Yamini, we are here to help you. If you need any help, you ask us. We will help you.
We will do anything. We'll leave a little bit of our laziness also for that.
Yeah.
हमारा भी कुछ भला हो जाएगा.
Yeah.
2 books, we must not forget. One is Therapeutic Pocketbook and BBCR. They are of a tremendous help. We do not repertorize. And in cancer, organs are affected. Metastasis, they are organs. Repertorize the organs. That is what Boningerson's very basic logic was there. Sometimes it is then miracle. I would share a small video in the group later on, which is a very interesting thing. Incidentally, me and Shruti were at Dr. Sarkar's daughter's wedding at his home. And it is the wedding procession is going on. And suddenly Dr. Sarkar's mood comes to teach Materia Medica. So I just recorded a bit of it. I will post it in the group. You can share among the close group, Dr. Yamini.
Please.
And me or Shruti are witness of it. And this is something like a gold mine, and I will be able to sense, why I'm telling Therapeutic Pocketbook and Boger Boningerson. Although this is from Boric, but at one point this all converge. Boric, Therapeutic Pocketbook, BBCR, they converge. I will right away share that video to you. I mean, Dr. Yamini, yeah, we can share that later on.
Dr. Sarkar,
I'm sharing Homaris and Populus tremuloids.
He was teaching as well. Doctor's marriage was going on. He called us in his prep, and he was peeping from window if his wife is not seeing. And as soon as he saw the group of relatives and women approaching us, he closed the door. Chalo, let's go to bed.
His wife will come and scold you both. Why did you come for the marriage?
हमने बहुत डांट खाई है. हमने बहुत डांट खाई.
हम खा लेते वो she scolds us in Bengali. हम समझते भी नहीं पर पता चल जाता है कि डांट की तो okay मैडम.
Yes.
Guilty accepted.
Yes.
That's great. I also want to mention one thing along with all these books. Though I am not a practitioner of Banerjee protocol, but in few difficult cases where I don't understand anything or I don't get an entry point into a case, I would definitely go and refer Banerjee protocol and see that actually what they do, because they deal with so many cases and in few cases of mine, I have seen good results by just giving, either first line treatment or second line treatment, depending upon the symptoms. So I just go through the remedies that, why they have selected few remedies which are very specific for few cancers. So I just wanted to mention that you can also go through, whether you practice or not, that's your choice, but it's a good book to refer for different sort of cancers, especially the neurological brain tumors and all that. They have a vast work on that.
I agree.
And that is how we all got interest in treating. First we read Banerjee protocol, then we thought there is something else. Then that is how you improve. So nothing wrong. Anything you refer helping is good.
I would like to add here something that although Banerjee protocols and everything is there, but we should not forget our stalwart. So sir has taught us to go with the source book. Hardik sir has always taught us to 3 long years. He has taught us only to go stick to the source book, TFL and HCL and Clark. So I've just made a small PPT that I wanted to share in the last this, but I was not able to share, so I've condensed it. Clark has also told something about cancer, and he has also given very pointer remedies, and also potency. Many people were asking about the potency. Also, he has given about the potencies, and ensures biochemic remedies is also one of the book. He has also directly given which biochemic remedies we can use. And Burnett, we should never forget in pathological case, as Hardik sir taught us. Burnett I came to know from sir, and also I use it in special children cases also. Burnett is also giving medicine with potency. There are other books also, but because of lack of time, I didn't mention all the
No,
book.
please share this in a group, no, so that
Yes,
we can
yes,
go
sure.
through in detail.
Yes, yes. As sir and madam told, whenever we are not getting anything case or medicine or pathology, same way I repertorize in software or hard copy in our repertories, hard copies. Go with the medicine or go with the organ. In autism also, like sir taught, I have treated more than 100 cases of autism till now. So all the autism cases, we don't have the specific autistic spectrum. So I'm just adding the symptom of the patient, and then we are getting the remedy. So that is a great approach.
Dr. Yamini, I just posted one link of PubMed
Yes,
in
sir.
the chat box.
Yeah.
Just send across to everyone who have participated, because that is a triple arm study.
Mhm.
And it was conducted by Austria homeopath, or not homeopath, they were conducted by Austria oncologist in a
Mhm.
hospital there. And actually it's a triple arm study, so not even double arm.
Mhm.
So the way the study has been conducted and where the results have come up, so it is very promising how researches are conducted.
Mhm.
I'm not comparing. Obviously, we are nowhere at that, because that requires a lot of funding to conduct such research.
Yes.
And I'm very sure this study must have been conducted to completely demean homeopathy, but results have been very different.
Okay. Great.
So everyone should read that it will completely open your different angle towards research. Because what we are talking is a lot of clinical thing currently and
Mhm.
practical things, but when research comes, that is a very different aspect. Everyone has to address that. And
Yes.
clinicians usually do not address the research things. Usually it has been academicians usually follow that, but if a clinician can follow that, it will be of a great help to everyone.
Very true. Very true. We are lacking in research a lot, and also the clinicians, like you said, they, including myself, I feel that I do not understand the research properly. I mean, the methodology and how to do it. Even if I want to do it, I can only collect the data, but like not do the research exactly. That is one thing which
So
we
that
all need to
article
do.
I am posting, so that article, because it very nicely describes the research methodology, what they followed.
Great, great. I will just put this, everywhere on the YouTube and on the email as well. So all of you will get it. Don't worry. Great.
Thank you, Dr. Yamini, for giving us this opportunity. At least through this, I came to know so many new things also.
We should be thankful to you. We should be
No,
thankful.
it is both the way. Thank you.
Thank you. Thank you. It's a pleasure. Okay. So
Thank
we
you.
have little
Yeah.
time. And the last thing which I want to ask everybody again, that one last message for all the participants from each one of you. So let's start with you.
Me?
Yeah.
Okay, I was waiting what others speaks. Okay. So this should be the last message. I was waiting what others. Why? Because like you have to be patient in treating this, and it's a long journey. Like you have to curtail your enthusiasm, because it's a topic which is attractive, it is lucrative, but at the same time, it is a double-edged sword.
Yeah.
So yes, so be patient and curtail your enthusiasm.
I totally agree. Sometimes it becomes so disappointing in the journey that because many cases which are on advanced stage, and even if you're treating, there are so many up and downs.
Yes,
Thank
thank
you.
you.
Yes, Dr. Shruti ma'am.
Yeah, I would suggest that learn to have boundaries and don't get involved emotionally into patient. Because for your own mental health and vitality, because this practice is, it seems very glamorous at the first glance, but believe me, the failures and mistakes that I've seen, witnessed, and gone through, right? If I would not have been objective, then this practice is very difficult. So you have to learn to see people suffering, dying very objectively. And when you are objective, you will be able to judge. And when you have a news that the patient was coming and begging you that save my life and has suddenly gone. So if you are not very emotionally strong, you will really get affected. You have to learn not to get involved so much into patient or any pathology. Give your best, do whatever best you can, and don't promise.
Yeah, very important.
Don't promise. Yeah, that's why our foundation name is prayers.
Yes.
That there is a possibility. We have seen failure, we have seen success. We will try to give our best. Rest of the things are not in our hand.
Thank you. Thank you so much. Yes, Dr. Jyoti ma'am.
I am little old timer now. So what I say is don't be too overconfident. First learn, read, there's so much of literature in our this. Just because somebody told, don't, spoil the cases. Read, take somebody's help if or some guidance if you need. But homeopathy really helps unless we know it. So that is what I want.
Thank you. Thank you so much. That's great. Yes, Dr. Hafiza, your words.
Yes, I would only like to request, or I would like to appeal to our homeopathic fraternity, all other doctors also, all senior doctors also, like how the channel, start a channel, or we should also bifurcate some cases, because as we all are experiencing, it is a huge topic, and it is a huge what we can say data. So everybody cannot be perfect in all the sense. Means we cannot even read about psychiatry also. We cannot even read in one day how much we will also read. So whoever is perfect, or whoever is more experienced, like breast cancer patients, madam is experienced, so we should always take her reference or her consultation. We should send the patient, or like that we should make some online like platform or something, I think.
Don't worry. As we have now fellowship in psychiatry, one day with Dr. Hardik and Dr. Shruti, we'll have fellowship in cancer also. I am looking forward, and I'll be first student to join.
That is a good idea.
With the enthu people around us are having, no?
No.
Yeah.
Yes, it is the need of time.
Need of a
Yes.
time, correct. Now with Dr.
Yes.
Gandhi sir, we are little, confident treating psychiatric cases differently. So maybe in coming years, we will have something like this. Looking forward.
Yes. So we should create some channel or network or something, so we can also help each other, and like we can get help from you also.
Yes, sir. You're saying something.
And I think madam is very much the part of it. So everyone is part of it. Let us be students for life.
Yes. Yes. Very true. And in the meanwhile, like Dr. Hafiza said, I would also would like the same that, in the meanwhile, we can connect to each other. Whoever you think, I always tell this to my students, colleagues, seniors, whoever, like, even if I want help, I would be very open to ask to anybody whom I think that could, help me in that point of time, whether it is a pathologist or a oncologist or a homeopath or a junior homeopath or a repertory teacher or whoever it is. If you think that that will help your case, or that will help you to gain more knowledge and to be able to treat better, of course, we should be open to ask and to learn both ways and also to share. There are so many things. Recently I was talking to one of my friend, a very senior homeopath from Kerala, and he was saying that, we had a very good homeopath in our, like in our area, and he was practicing till his like he was 90 years old, and he was practicing. He had very good knowledge, but he never shared. So, they kept trying that, please tell us what exactly you prescribed. But he said, he was so knowledgeable. I had very much, a very high respect of him. But finally, we couldn't learn. So then he started his own, some YouTube or something, and he started sharing things. He said, whatever I have seen and whatever it is I have learned, I am going to share, because, people may think that I'm at a very early stage and, I don't have anything to share, but I'm still doing it. This is what I have learned in life. So it was the same way I have learned that we should share and we should take help. We should not shy away from taking help, especially in cancer cases, because like Dr. Hafiza said, that is a need of the time. Otherwise, we would ourselves spoil the case.
Take help. I completely agree with you. Don't hesitate. Because always it is better than multiple perspectives than one perspective.
Yes. Okay, so thank you so much.
At least one thing I have noted. Last thing I want to add. When you are telling that ask everyone, like there's an oncologist in my area. So I had referred some patients to him, and we were not knowing each other. But then I was knowing that he's a good, reasonable, good practical oncologist. Now what is happening is things are turning in like that way, that whenever a patient goes with him, he at least updates me about, okay, this.
Yeah.
Yes.
So he started valuing us.
Yes.
Very true.
And this is happening very frequently with all of us, So what is the problem in that? They will have that view, like we also have a view about them. Accept that view. They don't like homeopathy. They don't like homeopathy.
And
But
so
then
there are different types of
homeopathy.
people. Not all are same. There are few good, not good. I mean, I should not say good or bad, but there are good, few people who would integrate everything, and some people who won't integrate. They won't like. So accept that fact. It's okay. And I also tell my patients, even when patients come to you and say that वो doctor तो मना करते हैं, वो समझते नहीं. I tell them they don't have orientation of homeopathy. It's not their fault. We have a orientation of little bit of modern medicine, which is there in our course. We have to study it. So we know कि basic क्या है at least. उनको है ही नहीं, तो उनकी गलती नहीं है. It's okay. आप call लो if you want to, go ahead with homeopathy or anything. So that's a, I mean diplomacy, but अच्छा लगता है.
बहुत modesty है, Dr. Yamini. इतना भी modest मत रहो.
Honestly, I feel this कि उनका orientation उतना नहीं होता है, इसलिए शायद maybe this sort of approach, क्योंकि बहुत standardized, हर protocol standardized, तो वो box में से कभी कभी नहीं बाहर आ पाते. But सभी एक जैसे नहीं होते. I have so many allopathic friends in my area who would refer, and I would mention one doctor who runs a whole cancer care trust. He has, it's a biggest hospital in the central India, which he is running. And I refer him so many cases. And I remember one case I referred to him, and it was just for the sake of the patient. So the patient had a breast cancer, maybe 10 years back. And this patient was a mother of my very close childhood friend. So, and she was completely into कि मुझे तो surgery कराना ही है, मैं क्या करूँ? And I tried explaining कि आपको ज़रूरत नहीं है, everything will be all right. But she was not able to understand. I said, okay, let's, send her to whatever she wants to do. It's her life and she has to take a call. So I just sent this patient to this doctor, Dr. Dharkar, and he called me and said, पागल हो गई हो तुम, क्यों भेज रही हो मेरे पास? She doesn't need surgery. She doesn't need chemo. Homeopathy will help her. I said, sir, ये आप बोलो उनको. It was my job done by him. So you tell her, she will understand. And this is one way which I would do with my patients also, that I would call if he's my friend or something, and I would explain कि ऐसा कुछ हो सकता है क्या, and if we get good opinion from them also, it's better for patient. So sometimes this also happens. Okay, so thank you so much. I'm very, very, very grateful to every one of you that you shared. You took out time from your busy schedules and you shared this wisdom. So grateful. And thank you to Dr. Hafiza also for helping us to organize this. It was her idea. She was very dedicated and she wanted to do something for cancer awareness. So thank you, Vitality Clinic, and thank you, Dr. Hafiza. Thank you, Dr. Jyoti, Dr. Hardik, and Dr. Shrutima. Everybody.
Thank you, everyone.
Thank you.
Thank you,
Thank you.
everyone.
Bye-bye. Thank you so much.
And thanks to all the participants who have joined, sent us the queries. Kindly send us your feedback also. It will be a motivation for all of us. And also, if you have further queries, you can contact to all the speakers or any speaker whom would you like to share or ask something, or you can just send us the email and we will forward it to them if you want that. So thank you so much. Have a great
Thank
day.
you.
Kindly share your
Bye.
feedback. Thank you.